In Islington, as in many other places, we are in the process of really defining what should be the core elements of our locality offer. So what are those core elements of providing community services around patient need on a population basis? And it made sense to, as part of the discussions around what the locality should contain, to actually use the intelligence that had been gleaned from this short-lived pilot, again in a very iterative way, to really understand both quantitatively and qualitatively what the lessons were, so that effectively we can really begin to remodel and redevelop, particularly our adult social care element based in the locality. And so I suppose the staff that were involved in that pilot are actively engaged at the moment to sort of, as part of that analysis, troubleshooting, understanding what went well, what were the positive elements, negative elements, to really build that and bake that into the service redesign. And the view is that there will be a redesign of the locality offer, the processes within which patients are referred and assessed, because often referral pathways are duplicated and the paperwork is very cumbersome, to really redevelop something based around multidisciplinary working. Part of this work is again thinking about what the skill mix will be required going forward. So thinking about a team such as the re-ablement team, what are those specialist skills that are required within that team? What are the generic skills that may be required, which could be provided by an extended team? And also to consider something about the grey areas, so those grey areas between the specialist and the more generic skill, and to begin to have an understanding of what the competencies are, and those areas that we feel are particularly important to our strategic development. So for us, key things are around being able to care plan, the concept of supporting self-care for individuals, because in Islington we have significant problems around mental health with one of the highest levels of psychosis nationally. It's a real important thing to begin to ensure that at every level of the team we have proper understanding of how to manage mental health problems. So it's how one begins to understand those core skills that will be required, map those to competencies, and then develop the educational programs to deliver those competencies, and then to ensure that those key elements are written, for example, into the job descriptions going forward, so that we actually have an understanding of what our core locality offer is, the staff that are contained within it, the skills and the competencies that are required to deliver that, so that we can then develop or commission the educational support to be able to deliver that.